Hey everyone, and welcome to this explainer. I want you to think for a second about a massive architectural build, like a towering skyscraper. We all know the sheer amount of time, the intensive planning, and the massive scaffolding it takes just to get a project like that off the ground. But what if I told you that one of the most structurally complex and honestly, absolutely crucial pieces of architecture you'll ever use builds itself from scratch in just a matter of weeks? I'm talking about your own lower jaw. It's this magnificent, rapid, and entirely autonomous biological construction project taking place right inside the womb. So today, we're going to break down the exact embryological blueprint of how the mandibular process develops and ossifies. Okay, let's just run through the 6 phases of this biological build real quick. We've got 1, the first arch and primitive mouth; 2, Meckel's cartilage as scaffolding; 3, nerves triggering bone formation; 4, intramembranous ossification beginning; 5, spreading the mandibular bone; and finally, 6, completion by week 10.
Let's jump right into phase 1, first arch and primitive mouth.
To establish the literal foundation for the human face, we first need to define a term, the stomadeum. Basically, this is the primitive mouth. Now, at this super early stage, it's pretty much just an opening. Its lateral wall, the sides of this primitive mouth, is formed by what embryologists call the first pharyngeal arch, or the mandibular arch. You can kind of think of this arch as the primary raw material that the entire lower face will eventually be sculpted from.
So how exactly do we get from a primitive little arch to an actual jaw? Well, as we just established, that first pharyngeal arch forms the lateral wall. But then, from its dorsal, or back end, it gives off this little bud. That's the maxillary process, which buds off and grows cranially to help form the upper jaw. Once that upper bud separates, the main part left over officially becomes the mandibular process. And here's where the real magic happens. The right and left mandibular processes start growing really energetically toward each other. It's literally like 2 halves of a bridge meeting in the middle, and they fuse right at the midline. This fusion forms the lower border of the stomadeum, which ultimately gives rise to your lower lip and your lower jaw, the mandible.
All right, moving into phase 2, Meckel's cartilage as scaffolding.
Like any major construction project, we need temporary scaffolding to support the build before the heavy permanent materials are brought in. Our jaw is completely the same. The scaffolding for the lower jaw is a structure called Meckel's cartilage, and it shows up incredibly fast during the 6th week of intrauterine life. We're talking days 41 to 45 here. It extends bilaterally from the ear region all the way down to the midline, where the 2 sides connect. But here is the truly fascinating part about human development. Meckel's cartilage does not become the jaw. No way. It's essentially just a ghost template. It acts strictly as a physical guide for mesenchymal condensation, which is just a fancy way of saying the gathering of precursor cells. The actual mandibular bone develops completely independently around this cartilage, entirely replacing its function before the cartilage just fades away.
Next up, phase 3, nerves trigger bone formation.
Because having raw materials and scaffolding isn't enough, right? We need site managers to actually tell the workers to form the bone. And surprisingly, the very first structure to develop in the primordium of the lower jaw isn't bone at all. It's a nerve, specifically the mandibular division of the trigeminal nerve, also known as cranial nerve E3. This main nerve appears at about 2/3 the length of our scaffolding, Meckel's cartilage. Then it splits. Medially, it becomes the lingual nerve. Laterally, it becomes the inferior alveolar nerve, which then further divides into the mental and incisive nerves. This incredibly precise branching geometry isn't just for, feeling your chin later in life. It is fundamentally crucial for the immediate build.
These nerves act as our biological foremen. They literally release chemical signals called neurotrophic factors. These factors are the direct command that induces osteogenesis, the actual bone formation, right in the developing ossification centers. Without the nerves arriving first to hand out the blueprints and trigger those chemical signals, the bones simply wouldn't know to start forming. It's brilliant.
That brings us to phase 4, intramembranous ossification begins. The signals have been sent, the site is totally prepped, and it all kicks off with the number 1. This massive, robust bone that lets you speak, chew, and express every emotion starts from just one single primary ossification center for each half of the mandible. It's a remarkably humble beginning for such a major, heavy-duty structure. Let's pinpoint exactly when and where this single spark of bone formation happens. It's still just the 6th week in the womb. The mandible develops largely by a process called intramembranous ossification. This single primary center develops right within the mesenchymal sheath. That's the condensed tissue sitting right next to our temporary scaffolding, Meckel's cartilage.
But where exactly on that long stretch of cartilage? Well, it begins near the future mental foramen, specifically right around the area where those foramen, the nerves we just talked about, branch out. The ossification kicks off precisely around the bifurcation of the lingual and inferior alveolar nerves, and again where the inferior alveolar nerve divides into the mental and incisive nerves. The bone literally starts growing around the nerve intersections.
Which takes us to phase 5, spreading the mandibular bone.
Once that primary center is established, the ossification starts spreading out in 2 distinct directions to build that familiar horseshoe shape of the jaw. If we look at the posterior or dorsal spread, the bone extends backwards to form the heavy body of the mandible. As it extends even further, sort of pushing away from Meckel's cartilage, it forms the vertical portion, the ramus, continuing all the way up to the future mandibular lingula. Now, at the exact same time, the anterior or ventral spread is pushing forwards. It's reaching out to meet its counterpart from the other side at the symphysis region, right there in the midline of the chin.
But listen to this. The bone isn't just growing as some solid, dumb block of calcium. It's a highly intelligent build. As the developing bone spreads, it carefully surrounds that inferior alveolar nerve we discussed, forming a protective gutter around it. This gutter eventually closes over to become the future inferior alveolar canal. And it doesn't even stop there. Above this canal, the ossification purposefully forms a trough-like structure. Why? Because it needs a safe harbor to accommodate the developing tooth buds that will one day become your lower teeth. Every single piece is interconnected and perfectly spaced.
And finally, phase 6, completion by week 10.
Let's just take a quick second to marvel at the sheer speed of this timeline. In the 6th week, our temporary scaffolding, Meckel's cartilage, appears. In that very same week, the primary ossification centers spark to life right around the nerve branches. And by the 10th week, a mere 4 weeks later, the rudimentary mandible is almost entirely formed. Honestly, that is an absolutely staggering pace for such a complex anatomical structure.
So the crucial takeaway here is this. We're witnessing the absolute triumph of intramembranous ossification. By that 10th week, the primary build is basically done. The permanent bone structure has completely taken over, having utilized Meckel's cartilage strictly as a disappearing template. The scaffolding did its job, and the permanent architecture of the lower face is officially locked in place.
It really makes you step back and marvel, doesn't it? Think about the precision required, the arch splitting, the temporary cartilage setting the stage, the nerves arriving to give the chemical green light, and then the bone growing perfectly around those nerves and tooth buds, all in just 4 weeks. It leaves us with a pretty fascinating question to end on today. If our bodies can autonomously engineer such complex, highly coordinated structures from temporary scaffolding in just a few weeks before we're even born, what other invisible blueprints are shaping us right now? Keep that in mind next time you speak, smile, or take a bite to eat. Thanks so much for joining me on this explainer. I'll catch you next time.